Hello, everybody. I have a minute to record, so I am on day 3 post-op. Day 3, right? Yeah, day 3. And themes, uh, things seem to be a little bit better than they were, obviously, the second day. I had some initial um, drainage the first day, but I think it was because um, the binder that they gave me was pushing on the incision. Other than that, sorry, my lips are still kind of dry from the breathing tube. Uh, Other than that, my pain I think has been normal. See, I've had a cesarean before, and I've had the tubal ligation before, and this pain seems normal. It's like a tugging on obviously behind the incision site, and kind of like a warm burning feeling. And I already know that it's a combination of things. It's nerves. It's the incision site is glued on the outside, so it's the skin shifting and stuff like that. There's been no major pain, thus far, but I feel like there's more action and more tugging going on my left side. Maybe it's because of the way I maneuver myself to get up, or the way I use more of one side of my body than the other. I don't know, but it's not unbearable. And the reason it's not unbearable is because first, I'm not pushing myself too hard. Secondly, they gave me a prescription for a medicine called Daypro. I don't know the exact name of the medication, but the commercialized name is called Daypro, and that stuff is awesome. It's I think it's an NSAID. Don't quote me on that though. And basically, it lasts like a full 24 hours. It's the way it's spread out is it lasts most of the day, and that's helping me tremendously. I was able to sleep last night. I'm able to get up if I want to. I'm able to get up on my own and go to the bathroom on my own without much assistance. And I'll tell you what, man. For those of you that are wanting to do this surgery and haven't done it yet, if you have like a month or two in advance, go to the gym as often as you can, because if you can build up your thigh and your arm muscles, they're going to help you tremendously right about now, because of the constant lifting and hovering kind of over the toilet initially. You're going to need them thigh and them arm muscles to help you out big time. So I'm being really serious. If you have a couple of months or a few months before your surgery and you're up for it, exercise your muscles as much as you can, because you're going to need them during your recovery to rely on to make up for the lack of abdominal muscle that you're going to be using, because you really don't realize how much you use your abdominal muscles until you're in a situation like this. And so work up those arms and work up those legs, because you're going to need them. Okay, and I don't know if I mentioned this before. I was still under anesthesia in the videos before. I have 8 centimeters on both sides, which is great. It's a great length. And I didn't have any issues as far as I'm aware, because the doctor would have told me if there was any issues. He did the dye test, which is a dye that they inject into your uterus to test to see if the tubes are open after surgery, and everything went fine. So I guess that's good. Ooh, that hurt. The procedure that I had done for my tubal ligation was, and I mentioned this before, it was those bands. So basically my tubes were just kind of banded like a little rubber band on top. So what he did was he removed the band and then sewed the tubes together. So we'll see how it goes from here. Apparently, because I had those bands, I have a higher chance of a quicker pregnancy rate and that sort of thing. But I will tell you this, guys, if you're going on this tubal reversal deal yourself, it's very common, and especially from what I've been reading, to have ectopic pregnancies and to have and to have lots of miscarriages before that baby finally sticks. So if that happens to me, I'm not going to feel too discouraged. Of course, I'm going to be sad, but I'm not going to feel too discouraged because I know that it's part of the process. Your body's getting back to normal, your hormones are getting back to normal. It wouldn't be too far-fetched to think that if you did get pregnant right away, that your body would be like, what the hell is this? What's going on? And then, kind of freaks out and rejects it. It wouldn't be too far-fetched to think that would happen. Did I say far-fetched like 10 times in a row? Anyway, I seem to be, this could be psychosomatic, but I feel more, I don't know, sunny, I guess. I'm in a better mood. I don't feel as down or pessimistic, I guess, is the best way to describe it. And just in a better mood. So that's always a good thing. Anyway, I think that I've rambled on enough. It's about 6 minutes in, and I will update here in the next few days and see if anything different happens, So, next time, and good luck.